I'm going to be demonstrating and talking a little bit about our monitoring devices that we use for anesthetized patients. One of them is the pulse oximeter. It measures the oxygen saturation of the hemoglobin. So it calculates the difference between the oxygenated and deoxygenated hemoglobin based on the absorption of the light. And you'd want to place this in on an area of the patient that is less pigmented, that has a little bit of less skin. So the tongue is where we usually place it. But you can also use the ear pinna or toe webbing, the vulva fold or the prepuce areas where the light would be able to pass through the skin. Ideally, you would want your percentage to be 98 to 100%. Anything greater than 95% would be good. At 90 to 94%, that's when you would want to start looking at the areas or the area that you're using, check the placement that the light can pass through the skin. If it's on the tongue, then you want to make sure that the tongue is moist so that the monitor can read it better. If it's under 90%, that's when the patient would start needing some therapy. So that's when you would probably want to notify the doctor, let them know that it's continuing to drop, and that you've checked the placement and it's not that, so that you can start taking the precautions to start treating the patient. Anything, if it's under 85% for longer than 30 seconds, that's when it's considered a medical emergency. So that's when, at this point in time, you've started trying to take the precautions to figure out what's going on and help the patient. Another one of our monitoring devices is the EKG, and it is transmitting the electrical impulses of the heart. So it's going to not only have a heart rate where you'll be hearing a beep noise every time the heart beats, but also transmitting a waveform that you could make sure is normal, or if there's any abnormal wave to the heart rate. So we have 3 clips, and we have white, which is right, so it goes on the right front arm or front foreleg. The black is the left front leg, and then the red is the left rear leg. And so once they're in place, then you would start seeing the wave along with hearing the heart rate. So you're just kind of listening out and making sure that it's at a normal rhythm. For dogs, they'll have a normal sinus rhythm, but they can also have a sinus arrhythmia where there is an increase in the heart rate during inspiration and then a decrease in the heart rate upon expiration. Cats would just have a normal sinus rhythm, so you're just listening out and just watching the wave and making sure that it's looking normal for the patient. For the heart rate for dogs, it can be anywhere between 60 and 150. So for a large breed dog, you'd want to notify the veterinarian if it is either under 60 or over 140, and for a small breed dog, if it's under 70 or over 160. For cats, their normal heart rate is 120 to 180. So you'd want to notify the veterinarian if it's under 100 or over 200 beats per minute, and kind of take a look at that. Another one of our monitoring devices is our blood pressure cuff. It's measuring the force exerted by the flowing blood through the arterial walls, and it's measuring how well the perfusion of the tissues are. And you want the blood pressure cuff to be 30 to 50% of the circumference of the patient's extremity that you're using. You can use the patient's front leg, back leg, or tail. to put the cuff around, and it's measuring the systolic blood pressure, the diastolic blood pressure, along with the mean arterial pressure. And so for normal ranges of the systolic would be 110 to 160, but you'd want to notify the veterinarian if it was under 80. For the mean arterial pressure, you'd want it to be between 60 and 90, and if it's under 60, then you would notify the veterinarian. Two monitoring devices that we don't have in our office is the capnograph. That measures the carbon dioxide in the air as to what the patient is breathing in and what the patient is breathing out. And so it would start at 0 and then almost form on the waveform, because it would have a waveform and then along with a number. So the waveform would almost form like a rectangle as far as the patient breathing in, how high the number go, and then breathing out. So it would kind of go up and then go back down. Normal would be between 35 to 55, but so you would notify the veterinarian if it was either under the 35 or over 55, and see what's going on. The sensor is attached to the endotracheal cuff, in between the endotracheal cuff and the breathing circuit. So this way it's right where the patient is breathing in and breathing out, and be able to measure the carbon dioxide that it's breathing in. Another monitoring device that we don't carry, but has many benefits, is the esophageal stethoscope. This would be a catheter probe that you would go down the patient's esophagus, and it go around the 5th rib, but you're just making tiny adjustments until you are able to hear the patient's heartbeat at a good volume. So then this way, if you're not able to see the patient's chest move, like if there's any drapes or anything covering the patient, you're still able to hear it if like you don't have your other monitoring devices or anything like that. This would be right next to the heart and be able to hear it. And so again, you're basically listening out, making sure that the heart sounds normal, it sounds at a nice steady beat, and notify the veterinarian if there are any abnormal sounds or anything that sounds different from what the patient's normal rhythm should be. Another one of our devices that we have is a thermometer. So you would take the patient's temperature and make sure it's in a normal range. While the patient is under anesthesia, it can be the temperature can be anywhere between 97 to 102.5 degrees Fahrenheit. So you would just kind of keep monitoring it and then adjust as needed. A lot of times the patients under anesthesia their temperature is going to drop, so you want to have heating devices on hand. Some of these heating devices, what we have is a hot water blanket. So we turn this on prior to the patient's surgery or prior to putting them under anesthesia, so that it can give it time to warm up. And then what we'll do is put it on the table, put a towel down, and then the patient gets put on this, so that the patient isn't on the cold table or anything like that. They're being nice and warmed up. We usually have extra towels on hand, socks or booties if we feel like it's going to be a long procedure or anything like that. Another heating device that we'll have is these little heating discs that we put in the microwave, and then we'll put them in pillowcases so that we can put these next to the patient when they're recovering or even during surgery to help keep them warm. If a patient's temperature is below 97, we would notify the veterinarian. If it's over the 102.5, we would let the veterinarian know as well in case there's any sort of reaction with the anesthetics, or if the patient's just getting too warm, if using too many heating devices, something like that, then we would let them know. But we try to make sure that the patient is warm, but at the same time able to, like with the heating discs in their cages, they're able to walk away from them once they're starting to wake up, so that they're not against them for too long, and making them too hot or anything like that. So we continue to monitor them, make sure they're staying warm and at a comfortable temperature. Those are the monitoring devices that we have to use for anesthetized patients.